Dr. Nikhil Datar is a distinguished gynecologist, accomplished legal professional, and dedicated health rights activist. He possesses a remarkable track record in both medical and legal domains. He is a founder president of the Patient Safety Alliance, an NGO committed to empowering patients and supporting healthcare professionals to prevent medical errors. His contribution to the field were acknowledged when he was appointed to a high-level committee by WHO and Government of India. I welcome Dr. Nikhil Datar.
Good afternoon, ladies and gentlemen, and thank you for those kind words of introduction. Thank you, Bhargav madam, for inviting me to give this particular talk. The talk is titled as Living Will. Okay, and I'm sure a lot of people must be interested in understanding what it means and what needs to be done. This is my brief introduction. Most of you know me as a maverick activist besides being a professional gynecologist who has made a lot of changes. I am one of those few doctors who believe that we in healthcare can change the law of the land if we really pursue and get it done. And you all know, most of you all know, that the Medical Termination of Pregnancy Act was practically amended because of my Supreme Court public interest litigation. Few of you must have seen my work that was showcased in Satyameva Jayate around rape survivors. So doctors have a lot of duty to play as far as social activism is concerned and judicial activism is concerned. A little bit of marketing. This book, which is published on this whole journey, especially currently it is in Marathi, it will get translated in English and probably a film is expected to come on this particular book. Those who are interested can find it out. There was a sudden spurt in the interest around living will when Times of India published this news on 26th of February 23 this year, and which said that there is a doctor called Dr. Nikhil Datar, who probably is the first in the country who has completed the legal requirements and has filed his own living will. Obviously, that is me, ladies and gentlemen. And that's why I'm going to talk about why did I do my living will, how do you do it, can each one of us do it, how does it work, will it actually work in our country, what will be the effects of living will on medical practice, insurance, organ donation, and I'm sure there's a lot of unanswered questions and answers and all that kind of stuff. So I'm trying to wrap it up in next about 10-15 odd minutes. Well, we all know that medical science is advanced and advanced so much that sometimes there are people where we don't know whether we should call them as whether we are prolonging their life or whether we are prolonging their death. And we all have seen this, and most of you are senior general practitioners. I am 100% sure that you must be helping your patients in this kind of a scenario and their relatives in this kind of a scenario in some or the other ad hoc manner, because there is no legitimate legal manner up till now realistically to help them. And here is what is the remedy for this particular kind of a thing. And then what starts? This is what exactly it starts. Typically, somebody is on a ventilator, put into ICU. On one hand, doctor says that he is Alzheimer, he is terminally ill, he is cancer, he is this, he is that. No realistic recovery is possible. But you know what? Person is on ventilator and we cannot disconnect the ventilator. On the other hand, the relatives want to disconnect the ventilator, but not take the person home. They want the treatment to be done in the hospital, and typically then the ball will keep on going round and round, getting the buck pass from person to person, and then they will probably come to you, and then you will talk to the consultant, and then try to find out some or the other informal way of doing the things, and then it's all very informal and all that kind of a thing. So I'm 100% sure once again that most of you will have this kind of an experience, and in this kind of a scenario, many a times what happens is that the ball just keeps on getting passed from one person to other person and then starts finger pointing, because one person of the relative says that nahi iska ventilator hata do. Then after 3 days somebody else lands up from US and that another sibling says ke how did you remove the ventilator in US? We are able to send these people home, walking talking they go home and all that kind of thing, and then doctor is in trouble, in problem, and we all have seen this kind of a thing happening again and again. Ladies and gentlemen, I must tell you that in our country, passive euthanasia has been actually allowed way back in 2005 itself. But you know what is the story? From 2005 till 2023, forget you and me, somebody as revered as Dr. Lopa Mehta, who was a professor of anatomy at KM Hospital, even she was not able to complete the formality of living will, because the way the things were, the way the guidelines were made, the way the law was made, it was practically impossible for anybody to do that living will in realistic manner. So you know what happens? You have something which is there, which is accepted, but on ground reality it is not there because it is not possible to be done. And we all know that this whole debate got started because of Aruna Shanbag and so many people and euthanasia debate, common causes versus union, all that kind of thing. I'm not going into the details. I'm just going to give you a plain simple summary that in our country, active euthanasia is not allowed. So it means giving a medicine or a drug to cause somebody's death is not allowed in our country, but passive euthanasia is very much allowed, and that's exactly why there was a petition which was filed very recently, and this decision was given in 2023, whereby the Supreme Court said that, well, passive euthanasia is very much allowed, and they reduce the requirements that are required for passive euthanasia, which makes it easy, feasible, possible for any one of us to do this particular thing today in our country. So basically, what is a living will? Living will just is a plain, simple legal document expressing the choices about their medical care, and one is incapacitated of decision making or communicating. These kinds of things can easily be done. So this is what is supposed to be a living will. So living will, advanced medical directive, medical power of attorney, do not resuscitate. This is the term that we all know medically, but ladies and gentlemen, this particular word has no legal sanctity. Please understand this, that although we take signatures as DNR and all that, it has zero legal sanctity, technically speaking, and it can very easily be challenged. And passive euthanasia, all these are confusing terms, but it all basically means more or less the same thing. So who can make a living will? It's very simple. Any adult of sound mind can make it. It has to be made voluntarily. It has to have characteristics of informed consent. I think that's straightforward. Now, living will is a document in which you are going to essentially say, of course it's by choice, so you are going to say that any of those kinds of treatments which will have effect of delaying the death, or those kinds of treatments which will cause more of pain or anguish, etc., one has a capacity and a right to refuse it. Now, refusing treatment is nothing new, everybody knows about it, right? But the problem is, if you are yourself unconscious, let's say I have Alzheimer's, let's say I don't understand, now who is supposed to take responsibility? Maybe my children. Now, if they have to take the responsibility, how are they going to decide about me? And when if children are going to talk to the doctor, then doctor is also going to be jittery because he doesn't know whom to believe, which of the two children he has to believe, and all those kinds of things. And that's exactly where putting this particular document is very crucial. And in this, one can definitely say what you want and what you don't want. You want ventilation, catheters, feeding tubes, IV tubes, CPR you want or no, medications you want or no. And it's obvious that I don't want to die tomorrow, at the age of 53, if I'm diagnosed with cerebral malaria and somebody admits me in ICU and says that please put him on ventilator. I don't want people to not put me on ventilator, right? But if I'm 85 years old and if I'm Alzheimer's or terminally ill because of cancer, then I definitely do want not to be put on ventilator, right? So these things need to be put into this particular living will as and how you are going to draft it. And ladies and gentlemen, two most important things which are absolutely mandatory. Please see to it that you mention about the pain relief, because today things like giving morphine, doctors are so very jittery of giving morphine because of their side effects. Although morphine turns out to be the best painkiller, but people are very jittery about side effects. So please give those free hands to your pain specialist or the doctor that you should use the maximum amount of pain relief so that your pain is taken care of. It doesn't matter whether you have a side effect caused because of morphine or no. I mean, that's subject to every individual. Every individual has to decide it. I believe in this. That's what I am saying, You have your own choices to decide it. And of course, organ donation, body donation, etc. So I'm going to rush through these few of the things that contents after the draft should be clear and unambiguous. And one very crucial important thing in the document that you need to do is that you need to write down specifically the names of those people who are authorized to take the decision on behalf of whatever you have written. Now it is but natural that if I am putting say my son as one person of authority, it is but natural that I have the required faith and belief in my son that my son will respect my wishes and not do his own job, what he wants to do. It is but natural, right? You'll have to give this authority to somebody. Okay, you can't not give authority to anybody and you yourself not in the capacity to take consent or give consent, then the things are not going to work. Now imagine that today I make one document and 10 years later I make another document. Then what happens? Then it is but natural that the later the document made will have the real sanctity or the effect, and the previous document, same like will actually. If you have made a will, the same story is applicable to will as well. Now a lot of people say that, oh, this is nothing new. I have put this in my will. Okay, that do not resuscitate and all that kind. I have already done it. My will is already registered. Please try to understand that will comes into play after your death, whereas living will comes into play when you are about to die. So the time at which these two documents operate are totally different. So that's why even if you have made a will, you have to make a living will, because will be opened only post death. Remember all those old Hindi movies when the lawyer comes after 8-10 days of the death of the person, of a businessman and all that kind of thing, right? So you don't want your will to be opened after 10 days of your death, in which you find, that on instructions have been written on how do you want to die and all that kind of thing. It is stupidity, right? So that's why you have to make a separate will, and this will has to be a legitimized legal document. There is no point in telling my daughter and my son and I have told this and I have told that and all that kind of thing. This is all very ad hoc. There is no proof. So you have to make a legitimized legal document. So do you require a stamp paper? No. Do you require to register it? No. Do you require a legal paper? No. You only require a few things. And what are they? You have to write your living will, take 2 witnesses, go to a notary and get that document notarized, and the matter is over there. Then what do? Then you make a copy of it, give it to a person who is your guardian or who is your, kin, you say, somebody who is going to take decision on your behalf, your son, daughter, whatever, saying, "Okay, boss, I have made this is what is my wish list, keep this with you. Tomorrow if it is needed, you have to show this, go to the doctor and show this." And additionally, you have to hand over the copy of this particular living will to a person in the municipal corporation who is appointed as a custodian for living wills. Once that is done, your procedure is complete. Of course, you can also in addition add it to the digital medical health records and all those kinds of things if at all they are available. We all know that today these things like Abha, etc. are coming big way, and DigiLocker for that matter is coming in big way. So you can definitely consider adding this. So how it is going to work? So if I am terminally ill, there is no hope of recovery and I have already made my decision, then the relatives will take the copy of this living will, go to the doctor, treating physician and tell, this person has done this particular document, he does not want to continue, this is what his wish list is, and that wish list is supposed to be fulfilled by the treating doctor. Treating doctor cannot overrun it or overrule it. Then the treating doctor first will satisfy himself or herself that, seriously there is a condition which fulfills this particular requirement. And what happens after that is, then hospital constitutes a primary board, which is of 3 doctors. They come to a conclusion. Then there is a secondary board, which is to be constituted again by the hospital. In this secondary board, one RMP will be a representative of a DHO, the district health officer. So how many people I have made my living will? My relative, he is taking that document, so that relative is put into picture. He is also in a part of it. Then first 3 doctors, then next 3 doctors, So 3 plus 3, 6 doctors, the person who has filed living will and the person who is holding the responsibility or the power of attorney on your behalf. These many people, when they all conclude together, only then the living will is supposed to be given effect, and you do not require to go to any court or any judicial magistrate or something. You have to only inform the judicial magistrate and the plug of the ventilator can be pulled out. Now, there are many ifs and buts. If, this board doesn't allow, then what? If that board doesn't allow, then what? But because of the paucity of time, I'm not going to get into those kinds of scenarios. But there are all possible conditions which are covered already. Now, I must tell you that this is when you have filed your living will. But what if you have not filed your living will? So today you might have a situation, today in the clinic you might have a situation that somebody is there, that person has not filed a living will, but the condition remains the same. Then in such a situation, can the same route be applied? Answer is yes. Even same route can be applied even today. So there is no need to get into this ad hoc mechanisms of DNRs and you say like that and I say like that and we write something and we do something and all that kind of drama baji. Absolutely not required. You can still legitimately do these particular procedures even today. Obviously, if at all I have made my living will, then doctors will feel more confident of executing it. If I have not made my own living will, then doctors will be little jittery because my son has gone to the doctor, but doctor will always think that what if the other daughter comes and says something else, then where do I go? So there is no solution to the problem, and doctor cannot find out who is the legitimate legal heir, and tomorrow some third person comes and all that. So best basically is to file your own living will if at all you believe into that concept. So there are a lot of questions which are unanswered, and I'm 100% sure that you will have 120 questions on this particular issue. Now to some of them, I also don't have an answer. But what I did was, I believe that let me put my skin in the game. If I put my skin in the game, then answers will have to be found out, or answers will come automatically. Ladies and gentlemen, healthcare and law both are made by humans, and they are made by humans and for humans, and human itself is an imperfect personality. So if somebody is imperfect, then things made for humans are also expected to be imperfect. Okay, so healthcare is also imperfect. We cannot give 100% guarantee to anybody. Law is also imperfect. We cannot make 100% guarantees. But somewhere we need to start doing the things, achieving this right balance. And that's why I decided to take first step towards achieving this right balance. So what I did, I became the first person. In Jan, the judgment came, and February 23rd, I filed my own living will. That's the first one. After that, a lot of these news articles you must have seen in Hindustan Times, Times of India's podcast is there, very nice one. You can hear it because it's a little longer one. Today we have got paucity of time, so in which I have discussed it more elaborately. Then Times of India requested me to write an editorial page article which was published on 1st May of 2023. Then I realized that a lot of people want to do it, but who will do it? Because today lawyers also don't know how to do it because it's so new, right? So being a professor of law, by the way, I am honorary professor of law at the National Law University, Maharashtra National Law University. I do not practice law. Practicing law is not my profession. It is my hobby. I purely practice obstetrics and gynecology at Cloud9 Hospital and my own clinics. I just do law for the purpose of activism. So I am a professor. So I roped in my students at the National Law University, and I'm extremely proud that the Pro Bono Club of Maharashtra National Law University has helped n number of people to file their living wills free of cost. Okay, I do not know whether we'll be able to continue doing that free work through NLU, but up till now we have done good number of these kinds of things. And then after that, I realized that it's nearly about a year. People have started filing their living wills, but government has not yet appointed the custodian or has not created the required mechanism to give effect to it. Now what do you do? That was a problem, because on your one side I am doing all this activism, making people aware, sensitizing people, making wills. But what do you do if at all the procedure is incomplete? Then how will the effect be given to it? And that is why I have very recently filed a public interest litigation in the Bombay High Court. I will be filing another one in the Supreme Court as well, So I have filed a public interest litigation in the Bombay High Court against MCGM, against State of Maharashtra, and against Union of India. Nikhil Datar versus State of Maharashtra and others is the name or the title of this public interest litigation. Very recently, 17th December, I mentioned this particular matter, in which I have basically said that Supreme Court's order is not being kind of carried forward, that needs to be carried forward, and this machinery needs to be put into place. So this is what it is, Professor Nikhil Datar versus State of Maharashtra and others. So I am expecting that this particular public interest litigation will compel.
Sir, 2 minutes more.
Yes, yes. It will compel the state government and the other authorities to get the system in place. Not only get the system in place, but also we will get a mechanism to digitize it, put into things like DigiLocker so that they are readily available. To put the system of RMPs who will be able to take care of giving effect. There will be dedicated guidelines for the doctors in terms of how do you give the effect, what are the criteria and conditions that one needs to meet up with. So this whole thing is expected to be achieved soon in the public interest litigation. I just heard today that the date for the public interest litigation's next hearing is just next week, that is next Friday. I will be arguing in the High Court in this particular matter. I am happy also to say that I am going to argue this matter on my own self. I am not going to appoint any advocate who will do that job, because I feel that being a person in the game, the vigor with which I can argue the matter, nobody else can argue the matter. So I am going to fight it on my own self, and I'm sure that we'll be able to get results much faster. Medical Termination of Pregnancy Act amendment took 12 years. For me, it's a battle for 12 years that I have been in the Supreme Court, but ultimately I was able to achieve the goal of changing the Medical Termination of Pregnancy Act in the interest of women, liberalizing abortions in our country, and I'm very proud of that particular thing. And I'm extremely sure that this particular PIL will not even take 12 months, okay, to achieve the objective. Thank you, ladies and gentlemen, for patient hearing.
Become an important part for the reasons very obvious. The lifeline, the age we live is increased to a quite good extent, and even the diagnostic techniques have increased, advanced modalities, and treatment modalities have changed. So in view of this, we tend to be longer in the hospital once admitted. So it's better we put down our living well, as well explained by Dr. Datar, what are advantages, disadvantages, how can we implement it. Thanks again for the beautiful talk and guidance to us.
Thank you.
I would like to invite Dr. Dholakia to felicitate Dr. Datar.
Friends, there are going to be 2 lucky draw after last lecture. We have 1 last lecture after this and 2 lucky draw for the day. So please do not leave as of now, otherwise you will miss the prize.